Hey everyone, my name is Dr. Berner, and today I'm going to talk about Foundation Chiropractic and really how do we get healthy as a society? Why is our spinal health so important to us? So I do this talk for new patients, their friends and family members, because besides doing a different technique that's more specific, focusing on the primary condition and getting that corrected, education is one of the most important things in this office. So throughout this presentation, I'm going to give you the straight, hard, cold facts. Everything is based off of science and research. There is no guesswork here. So with your permission, I want to cut through the fluff, shoot things straight with you, and give you just the straight facts, right? So what I'm going to go over with you, it has the ability of changing your health for the rest of your life, your family's health, your friends, and every single person that you'll meet from this day forward, which is a very bold statement to make. But at the very end, I'll ask that same question and we'll see where you come up with. So again, this is an introduction to Foundation Chiropractic and what really makes us different. There's a short little video I want to show you. It's called Staying Aligned. This is our one of the music videos that we did. Again, education is important, but also being able to communicate with others, being able to articulate what chiropractic is and what it isn't, and we can do so by a simple music parody. So I'll let this play out. All right, that was really fun to make. I have more videos on my YouTube channel. So I'm going to talk briefly about who I am, how I got here, and more stuff about me just for a little bit though. So again, my name is Dr. Berner. I'm a local, which is a surprise. I went to Palm Harbor University High School and then Florida State University. Go Seminoles, right? And then Palmer College of Chiropractic located in Port Orange, which is outside of Daytona Beach, where you can actually drive on the beach there. So my eldest patient on the top left here is my grandma. She unfortunately passed away last Christmas, almost at 99 years old, but still my eldest patient to this date, World War II veteran. So if I can help out someone at that age, a lot of arthritis without any cracking or popping of the neck, I'm sure I can help out you or someone you know that is around that age group. So in the middle are my two nephews. They've been getting adjusted since they were born. And yes, babies do have spines too, believe it or not. And they do so much better. Their body heals very, very fast when they get adjusted. They make great patients too, right? So I got these little kids adjusted when they were just born, maybe a week or two old, and they come into the office maybe once a month to get checked and adjusted if needed. They don't deal with throat infections, ear aches, which those are linked to a lot of the upper neck areas. They just have a better functioning, normal life for their age group. And then the top right is Dr. Teresa Stokes. We actually met in school. She's my fiance. We're getting married later on this year. But yeah, that's my chiropractor. That's where I go to and make sure I stay adjusted. She does a great job of making sure I'm all corrected and in the right position. so I can stay healthy and help out my patients. Here's some more pictures of my family. You can see my grandma wearing her World War II hat. Here's Dallas. Now, we have 2 therapy dogs in the office. Dallas is a Siberian Husky. She is turning 15 this month in March, and she loves attention. I've had her since she was a puppy, and she is an emotional support animal, just like Swanson. Swanson, he'll be 3 this summer. He's a Pembroke Welsh Corgi. Dallas is the Siberian Husky. Swanson loves everyone. I don't think he really hates anyone at all, unless you don't give him attention that he always asks for. The reason why I have the dogs in the office, besides it being a better place for me to leave them at my house, is that dogs, those of you that are dog owners and dog lovers, they provide unconditional love. And if there is a backup in our office and you gotta wait for a few extra minutes, why not spend your time, instead of on your phone, petting a nice, beautiful corgi like Swanson? So they also just provide a very loving environment. So dogs are great, they love attention, and they really make you feel good when you pet them. So that's why I bring my dogs into the office. Now, I have 2 patients in front of us, okay? The guy on the left, somebody gave him quality information to make choices about his health going forward. The guy on the right, he's a younger guy in his 20s or 30s, just wakes up every morning with headaches, migraines, vertigo, dizziness, a bunch of different symptoms, or what we call in this office secondary conditions. The difference besides their ages, the guy on the left, somebody gave him quality choices. Guy on the right hasn't received that yet. So today, I'm going to give this information to you like what I just talked about. It's going to change your health, your friend's health, family's health, everyone that you'll meet, and this day forward from this point. Again, bold statement. I'll ask you at the very end. So let's get started. The first question I want to ask you is, what is health? What does it mean to be healthy? A lot of us think, if I don't have symptoms, I'm healthy. What about this? Going on vacation, playing with your grandkids or kids, being able to do activities in life, social interactions, without having any limitations. Sleeping better, digesting food better. That's what health is about. So let's look at the actual definition. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Notice how it doesn't state, if you don't have symptoms, you're healthy. Our society is really just brainwashed. Every commercial that you see, I'm not here to bash pharmaceuticals, whatever you want to do to your body. The thing is having the education and making the own decision for yourself, most important thing. But us in New Zealand are the only 2 countries in the world that can legally advertise pharmaceutical drugs. So whenever you go on vacation and travel to Central America, you'll notice they don't have commercials for drugs. And that's the vacation that you need. We're so indoctrinated with symptom, unhealthy. Get rid of the symptom, now you're healthy. Health is more than just about that. It's about function. It's about optimal feeling and quality of life. Social interactions like what I talked about. That's what it means to be healthy, not the lack of symptoms. So what is chiropractic? Chiropractic is actually a Greek word meaning done by hand, performed by hand. First adjustment was 1895 by a man named D.D. Palmer. He adjusted his janitor in his neck. There is a subluxation, which is a fancy word for being the bone is shifted, pinching nerves, causing pain, but really it causes a dysfunction of the body. It inhibits the proper movement of a nerve signal from the brain to the organ and to other parts of the body to tell it what to do. So it's not performing at its best. Well, D.D. Palmer's janitor got adjusted, and he was first deaf in one ear. After the adjustment, his hearing came back. So D.D. Palmer wasn't able to help out all deaf people because he was not fixing deafness. He was correcting the structure of the spine, allowing function to improve. And that's how chiropractic was born. Now, that's 1895, but let's back up even further. As early as the 5th century BC, bone setters were highly sought after. You see in this tablet right here, it is the earliest evidence that we have of an adjustment. Because they knew back in the day that health is not some lotion, potion, or cream to mask the symptoms. Yes, health insurance is going to cover procedures that make your fall down the hill more comfortable. But is it ever fixing it? Is it just putting black duct tape over a check engine light, right? So they knew back in the day that healing starts from the inside out. It starts by giving your body a better foundation, right? A better foundation for it to function properly, okay? So what got me into chiropractic? So my dad, he always supports me, but my dad did about 20 years in the military, destroyed his lower back to the point that it was so degenerative, there was not much of a disc space left. And it got so bad to one point, because he's always dealt with back pain, but this time it was really severe. I came home from Florida State, and it just broke my heart. I saw my dad using a cane to walk around the house because his low back was so painful. I thought he sprained his ankle or hurt his knee or something, or gout of his toe. No, it was because of his back pain was so bad. So at the time, I was shadowing different, doctors. I found out there's different types of chiropractors out there. One of them that I shadowed did things a little bit different. She kind of used the tool and clicked behind people's earlobes, and their pain was gone. I knew I wanted to do something in the healthcare field. I just get a lot of joy of helping people. I make people laugh, and it's really fun to do. But to really improve someone's life, that's why I wake up every day. That's why I go to work 10, 12 hours a day, because I get to provide healing to people, fixing the cause of issues. So I shadowed this chiropractor that uses this gun, clicks behind the ear, pain's gone. I didn't know what she was doing. I was not in chiropractic school. I didn't do much anatomy class yet in college. My dad goes in there, he goes, you know what, let me give it a shot, because the orthopedist wants to do surgery. They wanted to fuse his body together. So yeah, if there is degeneration and the spine is like this, that's normal. But if it starts to degenerate, here we go. If it starts to degenerate and the herniation comes out, this is where we get sciatica. But then as the spine is abnormal, arthritis starts to build because the structure is not right. So my dad supports me. He listens to me, right? So he goes into there, gets these x-rays done, and what the chiropractor found that did things a little bit different was that his upper neck was so severely rotated that it was causing his lower back to tighten up, because it's all connected together. And if that top chain were to twist in some way, moving the spine out of proper alignment, causing advanced issues with the body, complications, this can lead to his lower back issues. So she got him adjusted. After he came back the next day, one adjustment. That's all it took. One adjustment, he stood up, and to this day, he has not used the cane ever since. That's why I do this, because it saved my dad from surgery, literally saved his life. He still comes in as a patient, one of my long-term patients right now, and he just does so much better because we're fixing the cause of the issue. So traditional chiropractic, I went to school for this. I understand how to twist, crack, pop the back, use the activator, that clicker that some of you probably know, and they help out a lot of people. I wish we had more chiropractors than dentist offices. As you see, every single traffic light you go through, there's probably one or two dentist offices there, because people value their teeth. They want them white and shiny. They want to obviously have real teeth for cosmetic reasons, to smile and have confidence, to eat food. You can get fake teeth. It's pretty expensive. You cannot get a fake spine. And to this day, we don't have the technology for it. We have disc replacement surgery and spinal fusion surgery. They don't have spinal replacement surgery though. You can't transplant a new spine into someone. You got one spine in your life, that's it. So traditional chiropractors, different set of goals. They're going to be cracking, popping, twisting, snapping. It's going to pretty much patch up drywall in the house that has a bad foundation. You go to buy a house, just moved to Florida, right? Or you're moving someplace else, or you know someone that just bought a house. What do? Well, before you buy it, you got to do your DD. You got to get a home inspector over there, okay? The home inspector inspects the house. He's going to make note of the drywall, the floorboards are loose, windows don't close properly, roof shingles are kind of misplaced. Those are all the secondary effects. The primary thing, he goes to you and he says, don't buy this house, please. Walk away, but it looks great. There's new paint, there's new carpets, So what? The drywall, we can just patch that up. Don't do it. The foundation's off by 3 inches. 3 inches off by the foundation, that's dramatic. And that is something that has to get addressed. So traditional chiropractors, crack, pop, twist, snap, improve range of motion, decreasing pain, decreasing muscle spasms, but we need to fix the primary condition. So with foundational correction, that's the global technique that we do in the office. It combines a couple different things. Number one being upper cervical chiropractic. So it's critical that the upper neck is in the right position. Think of that like the foundation of your house. Okay? Fix the foundation, everything else falls into place. Now we combine upper cervical with some laser therapy, at-home traction protocol, things that we use to get the best results and move your spine to normal. Fix the foundation, stabilize it, so I see my patients less and less. The more you're in my office, the more care we need. The less I see you, the more things you're doing at the house. So what is the foundation really? So the brainstem, as you can see, the upper part of the spine, literally your brain's extension. So it's coming down, it controls so many different types of things: blood pressure, mood, immune system, sleep, many things. So the atlas bone, again, back to the Greeks. Why do they call it the atlas bone? Well, because the Greek titan is holding up the globe, your atlas bone is holding up your globe, C1. C2 is axis. So we have the atlas bone on top and the axis bone. These are not real human bones, these are just models. So the atlas bone is spinning on the axis. That's why they call it that. So C1 atlas, C2 axis. A lot of our range of motion is done by these upper two bones. So if they move the most, they're going to subluxate the most. And again, a subluxation, bone shifts, pinches nerves, causing dysfunction. Subluxation of the upper neck, of the upper cervical spine, it's called the foundational shift. This is that primary condition. This is what we have to address. There's too much soft tissue in the way for hands manually to be able to crack, pop, twist it. There's no disc between this area. Again, atlas, Greek titan holding up the globe. Your atlas is holding up your globe. 2 holes on the side there, that's blood supply to the brain. That's the blood leaving the heart to your brain, go right through that atlas bone. There's little surfaces there. That's where the head sits on too. And then of course the center, the foramen magnum, that area of that, right above that area of the skull is the foramen magnum. That hole, that is where all the nerves in your body flow to that tell us what to do. The crazy thing is how we're made. It's pretty remarkable though, right? How we come from single cell to talking just like this. The blood vessel that goes from your heart to your brain does 4 90-degree turns going through that atlas bone. They had a research study done where they compared getting your upper cervical spine corrected specifically using these protocols and 2 drug therapy combination to lower down blood pressure. And guess what had better results? The atlas corrections. Because when we fix the issue, we're going to probably fix the... when we correct that bone, we're going to fix the cause of the issue, is what I'm trying to say. So whenever that upper bone were to shift, which can be from mainly 3 things, 3 T's: thoughts, trauma, and toxins. So thoughts would be negativity and stress. Trauma, micro traumas from our cell phones, looking down on our phones like this, car accidents, falls, hit your head, things like that. And toxins will be your chemicals and alcohol and smoking and junk food and all that kind of stuff. So those can all subluxate that area. The atlas corrections had better response because your body is not really deficient in a blood pressure medication. It's deficient in proper structure. If we remove that partial blockage of the blood vessel, we're going to prevent the heart from increasing pressure because, again, our body, the automatic operating system, is trying its best, no matter what you even think about doing, it's trying its best to survive and thrive in the environment that it's in. So when we restore that bone to proper position, just like the Leaning Tower of Pisa, we get your head on straight, life is great. Period. This archway, most important block, not the bottom, the top middle. The keystone to your foundation is one of the smallest bones in your spine, that atlas bone, okay? Migraines, dizziness, all these can be secondary because we have a foundational shift. We see a lot of TMJ people. So again, TMJ, temporal mandibular joint. right here, clicking, popping, probably because the atlas bone, now check this out, it's right behind it. So we see a lot of correlation with the upper neck being so shifted for most of our life, having this foundational shift, and it's not causing the jaw to operate properly. So we do get great response with TMJ problems, and the proper grammar is TMJD, D for dysfunction, or TMJ pain. Saying you have TMJ is the same logic or same wording as saying I have nose, I have shoulder. You're just naming a body part. You have a TMJ disorder, a TMJD, that's fine. So what we notice though, when we have these foundational shifts, the body's gonna compensate. The head's gonna tilt, one of the shoulders will drop, so do us a favor, look in front of the mirror when you get home, or if you're at the house right now, go ahead and do so. Look at your earlobes in the mirror. Look at your shoulders. It's hard to kind of feel your hips, but you can see your shoulders in the mirror or your head being tilted. Most likely that upper neck is not in the right position, and we got to stabilize it and improve that over time. This is what we look for because we see a lot of the times this bone is shifted. Now, when did it shift? Do we always have a foundational shift? Probably. How smooth was that birthing process? Ask your mom, right? Not very smooth at all. You didn't come out in 10 seconds and nice and easy, all done. No, it took time. Now they show with research that up to 90 pounds of pressure can be exerted on the infant's neck when they're pulling them out and try to get them come out of the womb. Imagine taking a baby's neck and doing this to it. Do you wonder why the baby is colicky and screaming and doesn't latch on and have developmental problems? Because they pulled it really, really hard. Over 10 times their weight, probably. You would never hold a baby by its head like this. So babies, again, make great patients. It's as gentle as checking your pulse, as checking the ripeness of tomato. We just do some muscle testing. We don't x-ray an infant, though. And they usually poop and sleep right after. They make great patients. So colicky, screaming, pediatrician says, oh, it's normal. Because the pediatrician is doing their job, what they're trained for. They see this side of the infant, this side of the child. What is that? Well, that's the things I don't look at. Not my hair and nails and stuff. I'm talking about pathology. I'm talking about tumors and things like that that we shouldn't be having, the red flags. I see that side. I see the other side of the picture. We can work together. We have several primary care providers and pediatricians that we refer to. I'm not going to be diagnosing. I'm not going to be doing shots or other things like that. We're going to put their head on straight and just allow the body to function better. So we can all agree about normal health values. We got blood pressure, heart rate, body temperature, eyesight, and ear function. With our spine, though, it's got to be nice and straight front to back and 3 curves on the side. Here's the spine. Notice these 3 curves. What we see a lot of is this forward head, this anterior head. And that's how we get that dowager's hump, that granny hump that forms, arthritis, and a boatload of secondary problems. Now it can go down into the lower back area too and cause lower back problems. So again, we want the ear evenly over the shoulder, hip, knee, and ankle. And we want the spine perfectly straight front to back. So no scoliosis. So no scoliosis at all. No scoliosis, period. So normal structure equals normal function. We want to get the spine in the right position, okay? The automatic operating system. Your body is automatically going to be driving itself just like a Tesla car and doing it best as it can. So there's 3 sets of nerves that exit the spine. We have sensory, what hurts us and feels good, motor, and organ development and organ tissue firing. 75% of the nerves that exit the spine are going to be the organs and tissue nerves. A small amount, 5 to 7%, are sensory, the rest are motor or muscle nerves. So if you're dealing with a problem like neck pain or back pain, that's a fraction of really what's going on. Everyone takes their car into the shop to get realigned, right? Every 6 months or so. What happens if you don't? Well, you start self-adjusting the steering wheel, just like some of us self-adjust our necks. Your body is trying to tell you that something is shifted, that, we got to move it this way, you got to move it that way. You self-adjust the steering wheel until you just get fed up. All right, I'll take you to the shop to get fixed. If not, more wear and tear, suspension problems, increasing the risk of a car accident. They don't just crack, pop, and twist your tires, right? They use this software to figure out exactly how that car is misaligned, right? And when you pick it up, you drive off the lot, it's driving much smoother, but you gotta go back for routine maintenance. This is what we do. We're gonna take advanced imaging. We're gonna take x-rays. Again, we have digital x-rays, very low dose radiation. It's so low now you need 5,000 x-rays done in one setting of your neck to have any increased risk of cancer, period. We get more UV radiation flying in airplanes, fluorescent bulbs in the office. The x-rays, we're doing more harm than good, not getting them done, not seeing what's going on. The benefit is in the x-ray and seeing how this looks, and also afterwards too, so we can check ourselves. We got a bowling ball on a piece of fruit. The bowling ball head can offset and shift, causing more compensations. Again, every inch of forward translation of the ear over the shoulder can add 10 pounds of pressure on top of the spine. So one thing to take home today, hold your phone up higher. Don't hold it like Simba and Lion King. Put it by your mid-chest, use your eyes and look down. You will do so much better. So we avoid dowager's humps. This is horrible. I did the Great American Teach-In and I see so many of these humps forming. How is this happening? Come on now. Kids are getting cell phones younger and younger and younger. If you see them, their posture is so bad. Their heads are so far forward. This picture right here, 60 degrees of movement of the head, of the neck going forward, that adds up to 60 pounds of pressure on top of the spine. So a dowager's hump can form. It's not a good thing. The sooner we can get this addressed, the less permanent it can be. So what's really causing this is this anterior head syndrome. Besides the foundational shift, this is one of the things that we have to address. We have to get the spine curve to normal and decrease this anterior head because it leads to arthritis, pinching of the nerves, disc herniations. We're right top of the dowager's hump. But then there's a laundry list of secondary conditions like carpal tunnel syndrome. 90% of carpal tunnel actually comes from the lower neck area, from the neck nerves, because we're leaning the head forward. We have that forward head. Why it's good to get a standing desk. Because if you stand, try to lean forward with your head that you do all the time when you're sitting at your desk. You're not going to do that because you're going to fall over. That's why a standing desk is so good. So 90% carpal tunnel comes from the neck. The nerves are stretched. They go down into this wrist area. They do an operation, a surgery covered by your insurance. You still got to pay 20% though. But what did they just do? Because the prognosis is not good. Some people have no change at all. They focused on the symptom. They focused on the secondary condition, not the primary condition. So MDs are talking about it. Head and forward posture can add up to 30 pounds of abnormal leverage, pulls the entire cervical spine out of proper alignment. In the Mayo Clinic, forward head posture leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. It's not just me talking about it. This is a real thing that is happening to everyone, probably from our technology. Remember this guy fell off his horse? What happened? He fractured C1, C2. Unfortunately, he didn't survive. His body slowly just stopped functioning. So a lot of different problems here that we see. We see them every single day. And we have great results because this is clearly just a dysfunction of the body. TMJ, arthritis, ADHD, ADD, sinus conditions, bedwetting, loss of balance. Especially if your primary care ruled everything out here, there's no pathology, well, it's normal. It's not normal. Having a normal headache is like having a normal tumor. No one should be having them. Get the problem addressed. So hopefully if you're watching this, and if you're sitting down, sit up nice and straight. You can roll your neck around in a circle. If you hear Rice Krispie treats, that's a biomechanical problem called crepitus, and it just means the bones are not in the right position. We could have some arthritis in that area, and the connective tissue kind of is sliding over that, causing that problem. So bottom of your shoes, look at them. You may notice the tread wear is a little bit different because you've been walking around lopsided, shifted, and leaning to one side more than the other. So what happens when we have these primary conditions? Degenerative disc disease, decreased blood flow throughout the brain, decreased spinal fluid flow, and then brainstem obstructions. So it happens in stages. We develop our neck curve just like this when we start crawling as kids, as little babies, right? Our head goes up and we crawl. Why it's always good to get tummy time too, right? So we lose this curve. So you can take your hand, do this, make a C. Look at that, shock absorbent, great. Now take your hands, make them straight. A little stiff, right? That's stage 1. Stage 2, we start leaning forward, then there's decreased joint spacing, okay? Stage 3, more forward. Then we get the arthritis. Then we get the degeneration of the disc. The disc can't handle all that extra weight. It dehydrates, it shrinks. That's when we start getting a lot of these symptoms, a lot of the radiation pain in the neck. The last thing is stage 4. Cannot fix stage 4. That's literally bone on bone, no more cartilage left. Very, very poor quality of life. Probably have to resort to more invasive procedures like disc replacement surgery, spinal fusion, all those types of things. So I want to show you this right here. These are two different patients because a lot of people think that arthritis is just an age problem, right? So this patient on here on the left is 53 years old. The guy on the right is 63. How does that make any sense if we all can, talk about arthritis as an age problem? It's a structural problem. The guy on the right, 63 years old, has been to a chiropractor most of his life. You can see spacing is wide, it's opened up, the arthritis is minimal, especially for a 63-year-old, because he has optimal structural alignment. He's very close to normal. On the other side, head going forward, anterior head, degeneration of the disc, abnormal neck curve, horrible. He said he would wake up in the morning and it felt like he was kind of crawling through fog, like space. So much brain fog, arm pain, migraines, vertigo, the issues in his neck. All that arthritis, is it permanent? Yes, it's permanent. We can't reverse physical matter. Once it's there to stay, but we have to slow the progression. So that's why it's important to start young. That's why I love to see newborns. I love to see kids. They're great. They get great results very fast, and they stabilize and maintain their positions of their neck longer and longer. So, two different pictures here. First off, we have X-ray. X-ray on the last slide, very low cost, quick to do, doesn't take too long. This is an MRI. We see the teeth on the very top, we see the atlas bone, the red line, and then there's an after picture, the atlas bone afterwards. We have a pre and post picture with an MRI. MRI, more expensive. We see a lot more detail, like the soft tissue. Takes a while though. Those of you who hadn't had an MRI, not the most pleasant thing, it's very loud. So my point of showing you this is that the yellow arrow, what that's pointing at is the jugular vein. So not only are we getting obstructions of blood from the heart to the brain, but also from the brain back to the heart. The waste that we have to circulate, resupply with fresh oxygen. So as we adjust that spine, we're getting that corrected. So those of you that know young Frankenstein, Gene Wilder, rest in peace, what he's talking about is making the Frankenstein monster, okay? And spinal fluid. What is spinal fluid? What does it mean at all? So CSF, cerebrospinal fluid, it washes the brain. It cleans out dead cells, waste, and we do this mainly when we sleep. That's why it's very important to get your sleep. As you know, countless of many articles are out there, people talking about it, that poor health is indicative of if your sleep is bad. Insomnia, very, very bad. So those that have any forms of brain issues, memory problems, Alzheimer's, sleep is very important. We have to clean out all that stuff in the brain. If not, they don't get a lot of sleep, memory problems, all their symptoms are worse. So it sounds important, right? CSF is very, very important. So let's say you're cleaning your clothes. Imagine the CSF is the detergent in your washing machine. So that's important, right? We all wash our clothes. We don't need discipline to wash our clothes, right? We use the detergent. But let's say you go out to eat, you come back, it's Friday night, probably too much red wine, okay? And you forgot that your clothes are in the washing machine. You wake up the next day, oh, wow, you gotta probably rerun the cycle. It may smell a little bit. What if you left your clothes in the washing machine and didn't change them out to the dryer after a few weeks? You probably would just throw them away. What if you did that for 50 years of your life? 5 decades of leaving your clothes in the washing machine. That's what's going on, because now we have these MRIs that we can see the spinal fluid flow or the lack thereof. That extra white stuff in there that you can see in these slices of the MRI of the brain, that should not be there. It's not circulating right because the plumbing system is clogged, because the upper neck bone is shifted. So they have research from 2015 that shows the craniocervical junction, CCJ, that's the upper cervical spine, is a potential choke point for craniospinal hydrodynamics, so the movement of spinal fluid. And it may play a causative or contributing role, it's causing or making worse, in the pathogenesis and progression, here it is, of neurodegenerative diseases. What does that mean? That means Alzheimer's disease, Parkinson's disease, MS, ALS, many other neurological conditions, seizures, chronic migraines. You see auras, ear fullness, eye pressure, brain fog could all be due to the spinal fluid not moving properly, and now they show it that it's causing or making worse. So here's a brain on the left, healthy brain, Alzheimer's on the right. Oh, as we age, our brain shrinks. It's not really shrinking. It's shrinking because the sewage in your brain is not getting flushed out. So we're going to watch a quick video. This is a story of Jim McMahon, former Hall of Fame, or actually he's a Hall of Fame quarterback, former quarterback for the Bears back in the 80s when the Bears were actually good. He's going to explain how upper cervical chiropractic has really helped him out.
Let's see, that one don't go there. There we go. Well, this is what I do to try to keep my brain sharp during the day. I've got these puzzles, and it helps me to just try to remember things, you know, colors and where things go. Well, I knew I was missing a couple pieces. You know, the doctor actually told me that this would actually be good for me to help keep my brain sharp and functioning, because at times it tends to wander.
Jim McMahon is 56 years old. He now spends most of his time in his Scottsdale, Arizona home, where the dry desert air best suits his long list of post-football aches and pains.
This is my daily routine. What am I doing? What am I looking for?
But what the climate can't combat are the symptoms associated with brain trauma McMahon suffered as a player.
Bad headaches, pressure on my skull. I couldn't see very well. I couldn't talk very well. All I wanted to do was lay down, because my head was just constantly pounding. The pain had gotten so bad where if I had had a gun, I wouldn't have been here. And these two doctors from New York called me and said, hey, we think we can help you. We think we know what's going on. I said, let's do it.
Jim was diagnosed with early onset dementia. He had been complaining about a brain fog, as he described it, as well as he described it, a headache where he felt like ice picking on both sides of his brain.
While most concussion studies are focused on the brain, McMahon's team traces the effects of CTE directly to the upper spine, having found that neck misalignment can block the flow of spinal fluid and pool toxic proteins directly onto the brain.
Spinal fluid is white. That's the spinal cord. This is the spinal column. What you're seeing is a narrowing of the opening where the spinal fluid is supposed to come through.
Most times when you're having head problems, that's all they look at is the head. These guys were smart enough to at least look below the head at the neck and see if there was a problem somewhere, and they found my problem. They're not going to be able to reverse the damage. Like I said, that stuff was sitting in there for 20 years. So how much it ate away at my brain, I don't know.
Using detailed images captured by the MRI scans, McMahon regularly receives targeted adjustments, clearing the blockage and restoring the flow of spinal fluid.
This instrument is going to generate a gentle mechanical tapping that is just lightly going to put those bones right back into normal position. Okay, I'm going to sit back up.
First time they did this procedure, within 2 minutes, it was like the toilet flushed. I could feel this stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. So you see how much there is there? See how there's less in here? Instead of all this white stuff being in there, you're seeing more brain tissue than fluid. So it's already started to brain. Over the next several days, it'll improve more.
What damage it's done, it's done. I can't reverse that. But what these guys do for me, they keep me from having these bad pains, having these suicidal thoughts, having me function fairly normally while I can.
All right, I want to touch on this picture again. We see the x-ray on the left, low cost. We see the changes of the curvature, increasing arthritis. On the right, we see the MRI. We see the pinching of the spinal cord right there. So this is what CTE is. Chronic traumatic encephalopathy. But look at this. Look at the Alzheimer's brain. I know you guys don't play football. This is what's happening. It's Alzheimer's sped up very, very fast. The spinal fluid is getting stuck. They probably can't sleep. Just a boatload of problems can occur if we do not circle through and cycle through that brain. So what are your treatment options? What other things can we do? because I would love to tell you that Atlas corrections can solve everything. It just gives your body a better foundation ability to function to the environment it's in. So some things that health insurance can cover will be some physical therapy. Wonderful. Stretch, rehab, post-surgery, amazing. Medications, if you want to take them, great, but taking a pain medicine for a chronic condition doesn't make any sense at all. Now, some people, they do need medications for certain types of diseases that they have, sure, but taking a medicine like that to combat pain, that's like a mom that's watching TV or puts in earplugs and the little child walks up to her and says, "Mommy, Mommy, I'm hungry." She ignores her. That's what you're doing when you take pain medicine for a long-term issue. Cortisone injections after a car accident, sure, acute trauma will decrease the inflammation. It's helpful for the healing process. There's people I know, a patient, that they used to get cortisone shots every single month of the year, which is illegal. They cannot have that many. It blows up the cartilage, but what does it lead to? The last one we have is spinal fusion surgery. So again, health insurance is going to cover things that make your trip down the hill more comfortable. Spinal fusion surgery, very expensive. Yes, insurance can cover 80%, but the recovery is not good. The prognosis, 3 out of 4 of them fail. No more curve correction. The segments above and below that spine have to make up for that lack of range of motion. And then they wear out next. Then you got to get another fusion surgery, or even worse, you have to go back in there and clean things up. And you're just getting surgery after surgery. You're not fixing the problem. They do this for pain management because if something is obviously herniated and you move that area, you're going to compress that spot more. Well, with the fusion surgery, you're not. So it's good at patching up the wall. It's patching up the cracks in the drywall. So our solution is simply, we get the head on straight. We use advanced digital x-rays of the full spine, but specifically of the upper cervical spine, to move it back to normal. Then we'll do 4 objective foundational scans. We got thermal imaging, which is going to be capturing the surface temperature, the heat of that area, which can indicate neuropathy, inflamed nerves, inflammation by itself, or if something is blue, dark blue, lack of blood flow. Raynaud's phenomenon of the hands or the feet, or just lack of blood flow because of severe arthritis of the spine. Then we have spinal thermography. We're measuring the temperature left and right of the spine, of where the spinal nerves come out of, seeing if there's any kind of differences. And then SEMG, static electromyography. Very similar to an EKG of the heart. It's picking up all the electrical activity of the muscle measured in microvolts. So it's basically digital palpation. So we have these scanners because this is the standard now. This is the technology that's present. Why would you not use it? We need to test ourselves. We need to test when we start. We need to test throughout the course of care to objectively monitor progress. Last one is going to be digital range of motion. So again, range of motion. Neck, side to side, front to back, left and right. And then the back, of course, up and down, side to side. So we also, with foundational correction, besides upper cervical and those scans, and curve correction tooth therapy, of course, we do class 4 cold laser therapy. Now, it's not a cold laser. It's not freezing cold like cryotherapy. Basically, a hot laser is going to cut your skin for surgery. What the laser does, a class 4 laser, is it will do photobiomodulation. Essentially what that does, it means, fancy word for, it's going to increase the ATP production in the cells, which is going to accelerate the healing process. Anything ending in itis, plantar fasciitis, arthritis, knee pain, back pain, shoulder pain, many different types of things. Only contraindications are pregnancy, active cancer, or cancer within 12 months at that certain area, and any drugs or medications you're on that have photosensitizing effects to it. Basically, if you're out in the sun for more than 10 minutes with the drugs or without them, your skin gets a little blotchy and itchy. So class 4 laser, we can't really use that on you. So almost anyone can use that because those parameters, those contraindications, it's not every single person. So I want to talk about different case studies. I love coming to work to help out people, but it's really more than helping, it's changing lives. So Mary's one of my first patients, recently married, daily migraines, painful menstrual cycles, inability to conceive. That's the important part. She was living on migraine medication that her doctor gave her. She just got married though. She's dealing with the painful menstrual cycles. What was really the reason of why she sought us out? is that the medications really stopped working for those migraines. She did not want to stay on pain medicine for painful menstrual cycles. And her doctor said, you know what, Mary? She's 22 years old, by the way. He wanted to do a hysterectomy on a 22-year-old. Let's take out the uterus. Let's just rip out body parts as opposed to fixing the issue, because painful menstrual cycles and he can't get pregnant, why bother? Luckily, she wanted to give this new chiropractor a shot. We get the head on straight. We restore the natural structure of the spine. After about a month, the migraine stopped because we're fixing the cause of the issue. Painful menstrual cycles were much more manageable because one of the muscles that contracts with painful menstrual cycles is the psoas muscle, PSOAS, which is, of course, Greek for loin. So that is your hip flexor. That will contract severely when a female is going through their cycle, which can induce so much pain, inflammation of that area. So if the spine's already kind of twisted and shifted, it can tighten one of those sides and make it worse when they have that cycle. So that's where we can clear that up. But the greatest part was that when she was done with the program after 12 months of care, we were seeing her only once a month, but she called us. She actually got pregnant, which is the best thing. This is why we do what we do, to give people back their lives, but create new life too, right? So case 2 is Kaylee, chronic headaches, TMJ pain her entire life. So bad, single mom of 2 by the way, but so bad, couldn't smile in front of a camera, couldn't even chew tough food, let alone even somewhat chewable food. She lived on liquid diets. She lived on protein shakes and green smoothies. Maybe some fruit here and there, but something softer. And it's always great to call my patients after the first adjustment and just check in with them. Like, hey, might be a little sore, your body's getting used to it. Again, use the heating pad, get a lot of sleep. But when you call someone and you can hear them smile on the phone, that you know that they're smiling, I knew we did something good. Which I expected that, but typically if something is so severely shifted, there's probably going to be some soreness. But she was in tears, happy tears for smiling, getting back her life, just being able to smile now. That's it right there. That's why we do it. So the last one I want to go over is Joyce. Not the best quality of life, but she's in her mid-80s though. A lot of arthritis, disc injuries, and goals of being able to walk her granddaughter down the aisle. That's what she wanted. Is we always try to find, okay, we understand you have pain, but what is this keeping you from? We want to know what your goals are. We want to be on the same page with you so we can help you meet them. Her goal was to walk her granddaughter down the aisle. We had about 9 months to work with. She was so much in pain. I had to adjust her with her standing up, facing the wall, and using that tool just like that. And then eventually, we got her to the table. She started with a walker. She didn't want to walk the granddaughter down the aisle with the walker, and then went to a cane. And then eventually she was able to walk herself upright. She still used the cane because of her age, and I did recommend that, but she did tell me she sucked it up. She got so much better that she was able to walk her granddaughter down the aisle, which is just an incredible story. And you can see the pre and post pictures for us to document everything. So Dr. Windsor is a pathologist. He looked at over 200 cadavers. He found that organs applied by pinched nerves reveal pathological changes. The more serious the pinched nerve, the more serious the organ damage. Every single one that he found. Someone died of a heart attack. The nerve from the heart going to that bone was shifted. Every single one. So it's so important to take care of our spine. Every patient gets their own specific foundational corrective adjustment, custom corrective exercises, and of course, a long list of complementary recommendations. We're going to be in this together. I'm going to show you what to buy, what not to buy, things that will be in tandem with the care, but also you need help with certain things like what shoes should I buy? Barefoot shoes is what I recommend for many reasons. You wear something that's very padded, like those on-cloud shoes. Yes, it may feel comfortable. You're putting your foot into a cast. It's not able to mobilize and move the foot muscles and everything. There's our corrector, just like Newton's cradle. It's just transferring that force based off the math that we did to get your head on straight. Corrective exercises, an app on your phone. Our pillows, which keep your head into a neutral, normal position. And then, of course, we have our roller. I'm going to play a quick video right here to watch and on exactly why we recommend our roller versus a traditional foam roller. All right, I'm going to talk about supplements. Now, I worked at GNC throughout college. I know a lot of supplements that are out there. A lot of them don't really do too much at all. What I'm going to talk about is things that are going to be beneficial for your health and wonderful to take with the care as well. Because you can diet by itself and lose weight, but when you combine diet with exercise, you get the best results. So, number one is, what is the most deficient vitamin? And that's vitamin D. We get vitamin from the sun. We convert it with the skin with cholesterol. Cholesterol can be good for certain types of levels. We just don't want too high of levels though. But we need cholesterol in our body to convert the sunlight vitamin into vitamin D active form. Okay. So what does vitamin D do? It turns on certain types of genes, prevents cancers, builds the immune system. If you have low levels, you're probably tired a lot, fatigue, depressed, joint pain, you're probably very deficient in vitamin D. So again, vitamin D, think of like a test on a grade on a test. 0 through 10 is your score, okay? 0 through 50 is failing. Forget about the Quest and LabCorp that show 30 through 100 is normal, 0 through 30 is abnormal, 0 through 50 is abnormal, okay? 70 is a C on your test, and 80 is a B, and 90 to 100 is an A. Get that level to 90 to 100. Over 90% of us don't have optimal levels, and a vast majority of us aren't even close to the adequate levels, okay? The darker your skin, the harder it is for your body to get in vitamin D. So people that have dark skin, it's really difficult to increase those vitamin D levels, meaning it's very important to take a supplement like vitamin D. Vitamin K2, the K stands for coagulation. It's German. Germans use a K, not a C. They found with K1 to help out with blood clotting. K2 is totally different. K2 transports calcium from the soft tissues and puts it into your bones and teeth. What does that mean? So less calcifications of the blood vessels, cataracts in the eyes, arthritis of the joints, gallstones, kidney stones. Basically, calcium in bad areas that it shouldn't be in, and immobilizes it. It transports it. Think of a postman that is going to make sure that package is delivered to the right house. So it puts into your bones and teeth, less cavities, less heart attacks, stronger bones. Everyone should be taking D3 and K2. Fish oils. Now, what makes our fish oils different? Well, first off, all of our supplements, they're third-party lab tested for verification, GMP certified. That is the highest form of certification for any kind of supplements. Why do we have that? Well, first off, supplements, they're not regulated by the FDA. FDA will regulate medications. They'll do testing on it. There's harmful side effects. Supplements, no. So it does cost extra for our supplements versus Amazon. Had a patient, they wanted to buy their stuff on Amazon, save 20% or so. Sure, go right ahead. Bring in the supplement. Let's go over it together. They opened up one of the supplements and dumped it out. I told them to dump it out, see what happens. Different colored pills. You're taking concentrated chemicals and things that are not tested with fillers and other types of junks just because you wanted to save $5-7. Don't do that to yourself. You deserve high quality supplementation, and we will never apologize for having superior quality supplements. It starts with taking fish oil with triglyceride form. Triglyceride form, TG form. If your fish oil does not have this, it's not in the best form. It's the closest thing to real fish tissue. Surprise, here in Florida, there's no cold water fish. Cold water fish have the highest omega-3 content. We have warm water, and a lot of the fish we have and consume are farm raised. So frozen fish, probably farm raised. If they do not have the magical W word, wild, it is not a wild caught fish. Salmon are pink because they eat shrimp. If it's conventional factory farmed fish, they actually dye them pink just to sell it. You're getting a lean protein, but you're not getting the omega-3s. All the omega-3s are crucial for your blood panel, for your heart, for your brain, for your joints. They line every cell membrane of our body. So if you have low levels of omega-3, you're probably going to get sick more. X-Flame, probably the most popular product. You need to titrate this though. When you're in a lot of pain, you can take up to 6 a day. Take it with food. It does help it absorb better. It has turmeric, boswellia, cresellazine, DMG, HCl. These incredible natural anti-inflammatories for anything ending in itis, but it really helps out the care as we get started because there's going to be some soreness along the way. Cold proof, when it is the flu season, really good ingredients in here that can help prevent being sick. However, viruses, once you got a virus, there's really no stopping it. You got to rest, you got to drink water, take fluids, and that's basically it. And you can take some vitamin D, you can take double up on your vitamin D, you can take some cold proof, But once you get that virus, that's basically it. Now, it's about prepping your body so you can recover faster. Adequate levels of vitamin D, and you can take cold proof to kind of work on that and get that better. So, probiotics. Probiotic, there's the CFU, the colony forming unit. You see right there, it's 50 billion. A lot of people, they go, oh, it's 100 trillion CFU. The colony forming units, it's not as important as the number of strains of species of bacteria. So turn over your probiotic label that you're currently taking. You don't see at least 6 in there, don't take it then. We need to give your body options to choose from. Different foods we eat, different stresses, different things we do throughout the day, and each day is different anyway. So give your body options to choose from. Our probiotic, there's 12 in there. So it's very advanced, amazing to keep you regular, gut health. There's a huge connection between the gut and your brain. You eat junk food, you're gonna feel like junk, and also chronic diseases later on in life. Problems losing weight, your gut is probably really bad. You gotta fix the gut if you wanted to lose weight. Serene is our magnesium threonate. So there's many types of magnesiums. You have Epsom salt, great, you can soak in that, helps out with stiffness, achiness. But if you drink the Epsom salt, if you read the back of the label, you can drink it, but it's a laxative effect because your body is not going to absorb that directly into itself and it's just going to extract it. That's it. You go to the bathroom, boom. So magnesium oxide, very, very low quality. Citrate's pretty good. The threonate though, the threonate will actually bypass your blood-brain barrier, so it's calming that central nerve system, the fight or flight, the stress, lack of sleep problems. Everyone is probably deficient in magnesium. Vitamin D, number 1 deficient vitamin. Magnesium, number 1 deficient mineral. You need to be at least 3 to 4 cups of spinach every single day. So eat your salads or just take a magnesium product like this. It's stevia sweetened, mix it with water. There's no artificial dyes at all. They get the coloring from berries actually. We only want to give our patients high quality supplements that don't have artificial dyes. So one of the most lowest cost things besides sunlight being free for vitamin D is drinking apple cider vinegar, or AKA acetic acid. This is a very, very amazing thing to do for you if you can tolerate the vinegar. So just take it, water it down with some water. They have shown in some studies that it can destroy the tooth enamel. So don't drink vinegar before you brush your teeth. Don't use it as mouthwash. It's very, very strong. You can put about a tablespoon of a tablespoon of the ACV of the apple cider vinegar in some ice cold water. It's better when it's cold, and you can just drink that throughout the day. You want to do a shot, chase it down with water, go right ahead, but it is crucial for our health. What does it do? It stabilizes the pH of the body. So what happens if the pH is off? Well, let's go to acid reflux. If the stomach's acid is not the right pH, the valve from your stomach to your throat is not going to close. You get regurgitation, you get heartburn, acid reflux, GERD. What do primary care docs do? There are a lot of smart docs out there. They give us antacids, destroys the stomach acid, which we need. Why would our body make the stomach acid? First off, it's at least 75% of your immune system is in your stomach. The stomach acid destroys anything that we consume or swallow by mistake. And so it burns off the infection, viruses, bacteria. But it also helps to digest and absorb proteins. We need that stomach acid to absorb these foods, digest them properly. Cancer will survive and start growing if the pH is off. Dandruff of the hair, apple cider vinegar, it's water soluble, you won't smell like it. You can use that in the shower, very healthy to do. Smelly feet, that's a pH problem, the floor is off. So taking this post-workout, lactic acid buildup, you're really stiff or sore, apple cider vinegar stabilizes the pH. You get sick, have a fever. By the way, fevers are actually good for us if they're under 103, 104, if you can tolerate it. When you take a fever medication to lower down the fever, you're prolonging your sickness. The body's fever is like a furnace. Again, just like the stomach acid as well, the furnace heats up the core body temperature, making it very uncomfortable for that infection to keep growing in your body. Try to tough it out. You will be sick less and your body will be healthier after. So apple cider vinegar, you can do it before a meal, after a meal. They've shown in research that it's better than metformin. at stabilizing blood sugar, which metformin, again, not the bash medications, it's too easy, but there's so many side effects when things like that, when we could just take a $7 thing like apple cider vinegar. So again, in summary, we want to get the spine to normal. When we get normalized, we don't feel better. I love when I have a new patient that comes through here and after a week or so of care, or even after the first visit, oh wow, my neck pain is so much better. Well, Ms. Jones, you're not better. You're normal. This is how humans are supposed to live. We're supposed to wake up every day and not have headaches and migraines and things like that. Those are all signals that something is wrong. Your body is telling you to fix it. It's the check engine light. You get adjusted, restore normal structure to the spine, you feel normal. Now, it does take time to fix. Healing doesn't happen overnight. To lose weight takes time. To learn a new language, a new type of musical instrument, takes time. To move the spine to normal takes at least 90 to 120 days, 3 to 4 months, to get acceptable correction that is more long-lasting, okay? So we want to keep the spinal fluid moving. We want to prevent, try the best we can to slow the progression of arthritis, Alzheimer's, move that spinal fluid around, and really don't ignore a foundational problem. This patient told me to use his films. Everything is fused together, almost stage 4. In the front, the lower neck, he was a machine gun holder in the war. He's pushing himself up in the walker because he cannot get vertical. He's hunched over and fused. So if you have something going on, please get it addressed. If you know someone that's suffering, please have them call the office. The consultations are always complimentary. We can sit down with them, explain what we do, and if they're a good fit for us, so we don't waste their time. We don't want to have people go through the office that, no, you shouldn't be here. You need to go get this taken care of first. Once that's done, then we can regroup and have you start the program. But you can't just jump into something, try it out for a couple weeks, say it's not for you, and quit. We have great results when patients that listen and follow through with care. So if you know someone out there, since you probably know the 90% of the population, so like Spider-Man 1 out of 17 said, right? Great power comes great responsibility, okay? I want to thank everyone for their time, for watching this video. If you stuck around this long, you're a trooper. I'm open to any questions you may have in the comments below, and help me spread this word. Everyone out there in our society, they deserve a proper functioning nerve system. We'll have less road rage, lower healthcare premiums. Everyone's going to be so much happier when the spine's in the right position. So once again, I'm Dr. Berner of Foundation Chiropractic. I'm going to leave you with our last music video. Kool and the Gang, Celebration. Thanks so much.
Foundation. Celebrate good spines, come on. Let's celebrate. Celebrate good spines, come on. Let's celebrate. There's adjustments going on right here. Precise corrections to have throughout the years. So bring your children and your spouses too. We're gonna fix their spines and party with you. Come on now. Celebration. Let's all celebrate and have a good spine. Celebration. We're gonna celebrate and have a good spine. It's time to get adjusted. It's up to you. How's your function? Everyone around town, come on. We are Foundation. We are Foundation.